Hello, we are going to be doing today your instructional video for your knee views. For your practical, you'll be doing an AP and lateral, so we'll be demonstrating those here for this instructional first. I'm going to start with Mrs. Skaggs being my patient, having a right knee injury with her laying back onto her back, right on this table here. And I'm going to be using a 10 by 12 cassette. And once again, as we recently learned, your little orange line, red line here is going to be at the bottom. So I'm going to put that into the bucky, and I am going to make sure it is centered here before I lock it into place. And I'm going to line my bucky up to my light, which I have already done. And I'm going to make sure I am at 40 inches SID. Now, when we're doing your AP knee, you're going to take some consideration into the size of your patient as to how you're going to manipulate your tube. As your book says, if the patient's measurement from their as-is to the tabletop is 19 centimeters, then we are going to be angling towards the feet. But if they are a standard, what we call average size patient, which is a measurement of 19 to 24 centimeters, then we would just go straight on with our tube for this projection. And if they're 24 centimeters or above with their measurement, then we will angle up 5 degrees towards their head. So I already measured Mrs. Skaggs off camera, and we know that she is an average size patient. But for your practical and likely in your actual clinical site, you're going to see everybody angling up 5 degrees for every patient. So that is what we are going to have you guys doing for your practical, and that's what you'll be doing in your clinical site. So I'm going to go ahead and angle here 5 degrees cephalad. And since I did that, I have to move my bucky. So I'm going to move my bucky up and get aligned. All right, and next I am going to make sure I shield Mrs. Skaggs here. Okay, now I'm going to find her anatomy here, her patella, and I'm looking for the base of her patella, well, the apex of her patella, which is the bottom of her patella. And then I'm going to go a ½ inch lower than that, and that's where I'm going to center. Alright, and I'm going to stick my marker in here on the lateral side, wherever I have a little bit of light. I want to make sure you're not in too close and you're in the anatomy. Now we're going to collimate in nice and tight. And then I'm going to make sure her foot is oriented properly so that her knee is very straight. And that means I'm going to turn her toe straight up towards the ceiling. And sometimes I even have my patient pull their foot back to make sure they're holding that position for me throughout the exam. Alright, looks pretty good. So I am going to expose this at 85 kVp. And next we're going to do the lateral projection. So I'm going to move my marker out of here. And I'm going to have her roll onto her affected side, which is her right side. All right, there's a lot of different ways you can get their knee lateral, but we're going to go for your practical with how Merrill's has it demonstrated, which is with the top leg or the unaffected leg straight and the affected leg bent at a 20 to 30 degrees and closer, right out here in front where you can see it. So I'm going to move around here and get centered right over her knee joint. Looks like I can't get back to her now, so I'm going to just move her leg back slightly. And I'm going to put a bend in her knee here about 20-30 degrees. And I'm looking to see if her patella is going to be in profile. So you may need to roll their knee down, you may need to roll their knee up. It just depends on their patella. For Mrs. Skaggs, this is in profile. And then I'm going to center just right in the middle here, and you may need to open your collimation side to side. Top to bottom, you should be fine. I'm going to stick my marker out here in front. And then I'm going to place the shield over her here, making sure that it's really blocking any scatter coming in this direction, because we're still angled at 5 degrees this way. So I'm going to make sure this is covering her now. Also, I like to have my patient flex their foot up again for this projection. It helps hold their patella right in profile here before I'm going to expose at 85 kVp. And that is the two views of your knee.